Welcome to Community Connected Health. I'm your host, Skip Lowe, and joining me, my co-host,
Colton Storla.
Good to see you again, buddy. Hope
Good
you're
to
doing
see
well.
you. Doing well.
Well, we got some great-looking guys here with us today, don't we?
Yeah, we do.
So we have joining us for this edition of Community Connected Health, we have Chad Charkowski, who is Director of Sales. Did I say that right? I mean,
Charkowski, you bet.
It just comes off the tongue here, you know. So
Perfect.
Okay, perfect. And you're Director of Sales and Operation, or you're owner,
You bet.
right? And then we have Zach Schmit, fresh off a trip from Tokyo, Japan.
right.
Yeah, he ran around the world and ended up in Tokyo.
Yeah.
So, yeah, great. And you're Director of Operations and also co-owner. So glad you're joining us today. And so your organization is Covenant Worksite Solutions. It took me a while because there was Covenant Family Solutions, which you're all kind of integrated and you're part of one big happy family. But I've done a lot of work with you. And so the topic today is really getting into an EAP. So welcome to the world of acronyms where we have PPOs, HMOs, and this thing called EAP, which stands for Employee Assistance Program, which has been a really hot topic. So we're going to jump into asking some questions. Zach, we'll start with you. Maybe you can just give us a little bio about yourself. How did you end up doing what you're doing? And again, just grateful that you're here today. And then we'll move it over to Chad, and then Colton will start asking some questions, and we'll get rolling.
Yeah, I love it. Thank you for having us. This is exciting and really an important topic. For me, I kind of jumped into this world in 2020 in the height of the pandemic, when crisis is being experienced everywhere, and we're seeing mental health really come to the forefront, especially within the organizations, and not just on a personal level. So I joined a really rapidly growing clinic called Covenant Family Solutions at the time, so very similar to our name. And we essentially launched the EAP, or Employee Assistance Program, through that platform. Fast forward, had a ton of momentum. We were helping a lot of organizations out, more importantly, their employees and their families at home. And in 2022, Chad and I, essentially, we acquired the division that we had started outright from Covenant Family Solutions and named it Covenant Workplace Solutions. So now we're two separate organizations, but we are strategic partners with them, as they have multiple clinics, tons of therapists, and they are, you can kind of think about them as our supply chain in a lot of ways, and we can get into what that means. But, over the last almost 4 years since that's happened, it's just been a heck of a ride to see the outcomes that these organizations are having.
You definitely have a full plate. There's no doubt about it. And you guys do incredible. I'm just going to go there and say God's work. I mean, it's just it's an immense amount of stress and anxiety out there, and you're in the thick of it. So where'd you grow up? Got to ask that. We got to get that in your bio.
Yeah, small town, more cows than people, called West Union, Iowa, up in God's country, northeast Iowa.
Yeah, we know right where that is. You
Yes.
bet. All right. Well, thanks for the background on that, and
Absolutely.
separating the parties of the supply chain versus what you guys are doing. I needed that help today.
No problem.
Chad, I'm going to act like I don't know you, so just start from the very beginning. But no, again, just a real quick background. And yeah, where'd you grow up? We'll start with that one, and then
No, I'm a Cedar Rapids boy, born and raised here in northeast side of town, and lifelong Cedar Rapidian. So
yeah, okay, great. And then you're Director of Sales and Operations. Or
Yeah,
sales
head of
co-owner.
sales, and
Thank you.
and a co-owner of Covenant Workplace Solutions. I was in the mortgage industry for 10 years, and it treated me well, but very transactional. I was ready for something that filled me up. I was missing that piece. And, I had been good buddies with Zach for quite some time, and he brought me into Covenant Family Solutions. And as he mentioned, we later acquired the Workplace Solutions division. I feel like there's never been a better time to have tools and resources available to help individuals. And it's, the mental wellness industry is near and dear to my heart. And I really wanted to find something that filled me up. Again, was a lot less transactional.
Yeah.
And I just absolutely love helping organizations, meet this need.
Yeah, well, thank God you guys are doing what you're doing because it is a tough job and there's just a lot going on in the market. So, Colton, I'll just put you on the spot. So, why don't we go ahead and just go into our agenda today? And what are the first things on your mind you'd like to have them share with us?
No, I think we should start right from the bottom and just explain what EAP is. I mean, I'm sure people know what it stands for, but really don't know how it's defined, how it's utilized, and things like that. And just like in our business, there's different forms of it. So maybe even give some background of, even if you know when it first started and how that was utilized.
Yeah, I'll start a little bit, and then Zach can add in. EAP, for those that aren't aware, just stands for Employee Assistance Program, but it's grown in leaps and bounds over the years. It's had many iterations. People traditionally probably think of an EAP almost as a throw-in that got attached with a disability insurance or something of that nature, offers some therapy sessions kind of when and if needed, but it often was very light. Yeah. It didn't get promoted very well. People didn't know that it was available. And so that's been Zach and I's challenge, is to re-educate people, not only on what an EAP is, but where it's truly going, right? In the robust nature of what we offer now. It's not just therapy sessions. Meeting people wherever they are with whatever they might be going through is vitally important, right? Having low to high touch tools and resources, to meet those people wherever they are, I think is super, super critical.
Yeah. I think, going back decades ago, this kind of started in kind of the substance use side of things and helping organizations that way. But it's really been more of a triage tool in previous years. And where we're taking this today is a much more proactive opportunity for organizations and the people that work there every single day. I think that when companies understand the benefit of providing this for their employees, because this isn't something that employees pay for out of their paycheck, there's a benefit that comes to them that way. It's also a confidential benefit, right? And so I know we can get into some of that later, but it is something where employees can really take advantage of this and either A, use this as a tool to get back to an optimal place in their life, or B, they can use it as a proactive resource to become a more improved version of themselves.
Yeah. I'm a bit of a historian, and you think about the GIs coming back after World War II and the tragedies and the loss that they had to endure. And, we also had World War I, we had a depression, we had a real tough group of people that came out of some really tough times. And so it's like, mental health has always been an issue. It's always been out there. And it's not like, well, now that we're identifying this, that people are just, it's kind of a free-for-all situation. But there just seems to be, going back to what you said, we added it on to our policies for life and disability for several years. You got three free counseling sessions per year, and they have a little bit of financial counseling in there, and they put some nice little slicks together for to be distributed at annual HR meetings or employee enrollment meetings. But this thing really took off, and would you say that COVID just kind of made it an exponential item or a diagnosis that people became even more aware of, and people now understand it's okay not to be okay? I mean, is that kind of the seminal moment where things started really taking off for you guys?
Yeah, I think that was an opportunity for the conversation to get louder around mental health, and we still have a long ways to go. But if we're just talking about stigma here, the stigma has come down considerably since that. The conversation back then, you almost were like, it was almost something like, do you see a therapist? If you even want to have that conversation. To now, a lot of folks are like, who is your therapist? Right. And just that little subtle change in how the conversation's happening gives folks a lot more freedom and comfort and confidence to have that type of conversation since the pandemic.
Yeah, and I think you guys are really kind of turbocharging that experience. And we've worked with your organization quite a bit. And the other thing that's really cool, because community connected health is about bringing different components of what we see as the future of delivery of healthcare, whether it's mental health or surgical care. But we've also seen where you guys are integrating with direct primary care physicians now. Because we call friends of the program, where they're able to maybe help call in a medication, or they will help with getting an MRI or some imaging, or they'll help with maybe even a surgical situation. We have, again, friends of the program, but doctors now, I believe you're familiar with those, that group that are out of Des Moines, the Stanek boys. And
Oh, yeah.
which is great to see. And I think that that's really futuristic. And that's why today's conversation, we feel, is just really fundamentally where we need to be and where we are going to be in this business. Because Colton and I think you were just saying a couple of minutes ago that, we're going out and writing group business. We're saying the basis of it's going to be DPC. And so, and that includes, an EAP approach to all this. So it's really kind of exploding right now, but it's also very fundamentally, it's in a different spot than it was over the last couple of years. And so.
Well, yeah, I was just going to add one thing to that is, right before the pandemic, Johns Hopkins released a number that 26% of individuals 18 and older in the United States at any point in time could be suffering from a clinically diagnosable mental health condition. So that is an important statistic, one, because it's probably a lot higher now through the pandemic, post-pandemic, but let's just say it's still 26%. Those are the individuals that a lot of organizations are thinking about when they think about employee mental health. Those that have already been diagnosed with depression, anxiety, PTSD, OCD, whatever it may be. What we're trying to do is, yes, that's part of the backbone of our program to help support those individuals, but I'm also looking at that other 74% that's out there, and there is a huge margin of that percentage of the population that just lost a loved one. They had to put their pet down. They're going through relationship challenges with their significant other. Their teenagers at home are unruly and they can't, build a relationship with them. And there's all these dynamics that are happening in their lives that they wouldn't be clinically diagnosable, but these resources and these EAPs are so important to those folks as well to help them navigate those struggles and be that version of themselves that they want to be, their favorite version of themselves, and then that productive person that the company also ultimately is also paying them to be there for. And so there's that whole segment that we don't want to overlook. Beyond that, let's talk about the proactive approach, like the EAPs today, and this is why we call it our lifestyle EAP, and we can explain more of this later, but there's this proactive nature to it where you might be, going through this season of your life where everything is phenomenal, right? You just got engaged, or you just got married, you just had a kid, or you just got a promotion, or, you got a big race coming up in Zion, like Colton's leaving for tomorrow, which I'm excited about. And things are just jamming, right? Mm-hmm. But there needs to be these tools where you can keep building on this, and you can also fix your roof before it rains, and you can see around the corner, and you can optimize your life now. Yeah. And using it through that lens. So that covers that whole 100%.
Yeah, we talk a lot about, just like the absenteeism and presenteeism in the workplace. And it's hard to measure because people are having financial stressors or mental health stressors. And we talk a lot about, the health insurance plans and how they stress people out because of how big the deductibles are, the co-pays. And so we talk a lot about just how can we remove the financial barriers to care? Because then that's just one less thing you have to worry about. Get people access to primary care, get people access to that surgery, get people access to that nutritionist or that EAP, mental health, so on and so forth. Because if people aren't taking that proactive approach or even a reactive approach, people could probably self-diagnose in some cases, but because of the financial strain, they just avoid it or what are my colleagues going to think, or what is my family going to think, or things like that.
Yeah. It was about 5-6 years ago, Zach challenged me to proactively work, carve out 15, 20 minutes to proactively work on my own mental health and wellness. And I'll be very transparent and honest. I was like, whoa, what is that going to look like? You know, what am I going to have to do in this 15 to 20 minutes? I guess what I found was, you know, I was consuming content, curated content in the mental health and wellness space, things that I was probably already diving into in some form or fashion, you know, a podcast that I was already interested in, a book that, you know, I had on my, you know, to read list, you know, videos I was consuming. So that proactive approach is really near and dear to our heart. You know, we've all seen what happens when, you know, we let things go and we react to situations. Obviously, it's a lot more costly to an organization when, you know, we allow it to linger, if you will. And so just really challenging, you know, the members of our lifestyle EAP to proactively work on their own mental health and wellness has been a big piece for us.
Yeah, that's definitely a different angle. I'm glad I'm learning what I'm selling, by the way, today. But I know about the lifestyle. We've talked about that a few times, joking aside. But that proactive approach, that's where I think that's a differentiator for you and other EAPs that we deal with. It's like, oh, we're here if you need us a resource. And people spend, 5 minutes in their enrollment meetings and they're half asleep, especially when I'm talking, because I speak a whole different language. You know?
I would say even like the EAPs from the past, you know, that would just be tacked onto that disability policy. It was, you know, kind of that sounds good on paper. You know, we've got this benefit on top of our benefit. Easy to buy, but then not communicate or utilize. So maybe you can speak to that a little bit. You know, not all EAP programs are created equal.
Yeah,
Are they?
100%. So many people check the box and like, we've got an EAP, but then they don't really understand what they have their hands on.
Yeah.
They certainly don't promote it very well. And so that's a big piece that we try to educate people on is increasing usage and utilization and the importance of that.
Yeah, I think, you know, there are more old school sort of traditional EAPs that their business model does lend itself to lower utilization, right? I mean, the highest cost to an EAP program itself is when the sessions get used, which is a whole rabbit hole in and of itself. And one of our main objectives is to turn that on its head, drive the adoption of the EAP, get the individuals utilizing as much of it as they possibly can for whatever it is that they need it for. You know, because if you think about it, and an individual on one of these throw-in programs, they're struggling, and somebody gets the information, hey, call this, you know, random 800 number across their desk. If that even gets across their desk and they do it, their world is typically already on fire. And then they might have 2 or 3 sessions, and then those sessions end, and then they're not where they need to be, right?
Yep. Well, we have a lot of our group's employers and their employees. They're using like a doctor on demand service and calling in for mental health. They end up getting charged for it. And one of the key drivers for us is educate. You know, we sit and meet with the employees, we do them, and then we go in the middle of the year and say, hey, how are the things that we're deploying? Because we're doing some pretty radical stuff here, and EAP is certainly at the top of that list. And getting that information in front of that member and meeting them at that moment is just, it's eternally crucial to, you know, our success on this. Some of the questions we get on, you know, you're located in Eastern Iowa. We have employees that are located in Storm Lake or Omaha, Nebraska, or in Colorado somewhere. So your response to that is I believe you're working with aggregators that you got friends with the program to help people get the resources that they need. You also have a 24/7 call-in line, crisis line, basically, right?
Yep.
So maybe speak to that. You guys actually work, you know, you may be kind of Iowa-based, but you do have connectivity throughout the country, correct?
Yeah, I think, you know, so part of my role in operations is to make sure that the scalability is there for organizations that have 10 individuals or 10,000 individuals, and making sure it's a seamless experience, you know, for either of those companies or regardless of their location or industry. what we are able to do is our provider relations team is able to expand our preferred provider network, or friends of the program, if you will, as demand dictates, right? And it allows us to have a tight quality control over the providers we allow in that we do work with, and make sure that when they are in the fold, that we have an organization that has members that we will be funneling their way. But it allows us to do all the due diligence. It allows us to do the quality assurance steps. And so, and it works kind of a couple different ways. While we're headquartered in Iowa, we have a lot of organizations that are just multi-site. Maybe they're all over the country that way. Or we have an organization that has remote employees in 40 plus states, right? And they're all working from their home office, and, meeting them where they're at so they can have an in-person experience or a virtual experience, some combination of both, and making sure that that's available to them.
What kind of data or metrics are you reviewing on your side to make sure that, people are getting access to care and so on and so forth?
Can you elaborate on that a little bit?
Like as someone calls in, I'm sure you guys are tracking, what group did that come from? Where are they located? Are they going the virtual route? Are they going the in-person route? Do we have majority of our people doing virtual, or do we have the majority doing in-person? How quickly are we getting them connected with somebody? So on and so forth.
Yeah. Okay. Great question. So there's a lot to that, right? I mean, so when somebody contacts us, the first thing we want to do is obviously understand what their primary objective is. And so we go through this process because they contact our member experience team, and what they are trying to do is meet them with speed, both in terms of like getting what they want, but then also in for that first session, doing it really as quickly as possible, but also matching them with their preferences. So it's kind of this Venn diagram overlap. Sometimes we get asked, okay, what's your average time getting somebody in to be seen? Well, that's a very individualized question that's hard to throw an average out there, because we have one person that calls in and they say, okay, I'm in Marion, Iowa. I require in-person. I require a male therapist. I require somebody who has couples counseling or couples therapy in their background. And they really just like narrow the window on what they're looking for. And that person, that therapist, might have a caseload that you might not be able to get in because it's so specific for 3 weeks. We also have somebody that says, hey, listen, I have no preference if it's male or female therapist. I want whatever's first available, in person or virtual. And they start to give us those types of variables. And now we have a little bit of a different approach to matching them. That person might be in to be seen in the next 24 to 48 hours. And then everything you can imagine in between. So we're tracking, do they want virtual as their primary experience? Do they want in person? Now, going back to the pandemic, we saw obviously a required virtual presence, in a lot of aspects, and in most states. And then we saw it really swing back hard because people just deeply craved that in-person connection again. And now I think what we're seeing is a steady climb back into a virtual preference, simply because it's more convenient, and people can do it. The bandwidth, or the broadband, the internet connection is so good, especially in rural Iowa and other places like that. Right. They can do it from their tractor, from their truck, from their couch, from their office. I love it. We have members that go on walks down a trail or on a lake, and they're on their AirPods and they're doing a session just like that. So it goes back to meeting people where they are and what their preferences are, rather than us trying to jam a square peg into a cylinder hole. And we do keep track of all that. Yeah.
Would you say, are you tracking, I'm sure, without me knowing the statistics, I feel like the female population are more likely to engage with a therapist or mental health provider. Would you say that, on the male side of things, that is becoming much more prevalent?
Yeah, I would say. What's your experience with that?
100%. You're absolutely right, where the female population does have higher utilization, but that it is creeping up. I think getting a little bit back to the stigma behind mental health and wellness, while we have a ways to go, it's getting better, right? And I think the male population it's extremely getting better, because, and COVID helped to your point, Skip. I think, for all the things that COVID, all the issues that COVID created, it did help with the stigma behind mental health and wellness. Nobody wants to go back to, being locked in and not being able to communicate and be with people. So, I think seeing the increase in usage and utilization among men is something that will continue.
Yeah. I feel like even with, Skip and I, we're, working with a lot of self-funded employers or a quasi self-funded plan. So we're getting access to more data, which is great. Because in some of those fully insured plans, we don't get any data. We, communicate an increase and, you go down the road. But, how can you take any action with no data? And so employers are starting to demand that. We're in a very data-driven world now, and that's the best way that they can make decisions. And so just having access to that data, Skip and I, we've reviewed some of those reports, and pharmacies just continuing to skyrocket. And a lot of it is those, depression medications, anxiety, so on and so forth. One thing that I'd be curious about would be, how many of these individuals are going to primary care saying, I'm depressed or I have anxiety. They're getting prescribed the medications, but they're not even seeing a mental health provider.
Yeah, it's interesting. I'll let Zach speak to this a little bit, but let me add this piece in. We have med management at every one of our locations, but unfortunately, in this day and age, we feel like med management is often overprescribed, right? I hate to say that big pharma, getting their hands in there, it just truly is overprescribed. So
it's on TV. It's in our face every second.
We really try to educate people on 4 or 5 things that are super, super important that, there's peer-reviewed studies, case studies that talk about the importance of sunlight and how that impacts, your mental health, quality sleep and how that plays a role. We've always heard about nutrition, Zach being Captain America here.
Yeah.
There's
2 of them in a room.
Yeah, it's true. Very true. Eating right, working out, but it doesn't have to be a high intensity workout, right? Simply getting your steps in but educating people on the importance of doing this first, right?
Yeah.
Again, med management has its time and place, but we try, 5, 6 different things go down this path before we would ever get to med management.
Yeah, because
Great.
not to go on a side tangent, but GLP-1s are exponentially growing within health plans, and employers are trying to figure out how they can just take on these costs as a health plan. And so some employers are saying we're not covering it for weight loss, we're only covering it for people with type 2 diabetes or pre-diabetes, but some are going the next step and saying, but you also need to be meeting with a dietitian or nutritionist or something like that, trying to or communicate to them that, hey, this isn't going to be a forever thing almost, instead of, just sticking yourself and, moving down the road. So I'd be curious if, employers kind of, took that stance on some of these other medications. But that's a good point on the medical management side of things, because yes, there are a lot of benefits to sunlight and, just walking, and you're having a bad day or you get that email and you just need to step away and go for a quick walk. Like, how much more better do you feel? Or even
100%.
Breathing exercises. Whatever it is.
Yeah, and I think even going back to the GLP-1s as an example, part of why it's important to us to have this physical health presence within our lifestyle EAP platform, because of the direct connection. They just go hand in hand, your physical health and your mental health. And oftentimes, it just takes one to go south quickly, and the other's not too far behind if we don't take care of it. But with the GLP-1s, perfect example, our strength training programs, like we have full 8, 10, 12 plus week, fully phased strength training programs for individuals that have access to gyms or maybe no gym, just at home, or if they travel all the time for work. But why that's important is, the GLP-1s, if you're not doing some form of strength training while you're taking that and you don't have the proper guidance, you're going to eviscerate your lean muscle along the way. So it's like you just lost 20, 30, 40 pounds, but it's not all the weight that you wanted to lose. It's not all the fat that you thought was coming off. And so pairing your GLP-1s with a great strength training program is just another one of those tangible values that, this program could add to that individual who's having those types of medications.
Yeah, 100%.
Yeah, that's one of the hardest things to get people to, partner up with their physician or the treatment program that's been given to them on these GLP-1s. Yeah, I'm just looking at these things and wondering what it's going to look like in 5 years. Now, I lived through the fen-phen era. If everyone remember fen-phen. Logan, how about you? Remember fen-phen? Okay, he's shaking his head now. I pay him to shake his head no at me. Anyway, fen-phen was like this miracle drug. It was kind of like a GLP-1, but it exploded on the scene, and people just, it made them look like they were in shape, and they got real skinny real quick. It was like, this is like too good to be true. And this GLP-1, I'm seeing this kind of repeat happen, and we have talked to primary care doctors that are adamant against those just because they're seeing people, their hair is falling out. And I don't want to scare people on here. I know they're working for a lot of people, but the muscle mass is a big deal. But you pose a big challenge there to really any population, because we tend to start beating up the industry, big pharma and the carriers, and there's certainly enough blame to go around. But we need better healthcare consumers. And I think that's what we're all trying to work towards is, get access to affordable care, get access to affordable mental health, their medications, et cetera. We all have to work together in this ecosystem. And I do think that there is a movement out there that is starting to work. But I'm going to ask you a question real quick here before I'm going to digress a little. But I'm just curious. Just seems like mental health is really out there. It's in the forefront. I don't think it's going to be going anywhere anytime soon. We got a lot going on in the world. In case you're paying attention, and I think my phone's
probably right now
100 times. I'm like, jeez, it's like Morse code. It says, "Shut up, please." Anyway, I'm just curious. You talked about supply chains. Are there enough mental health professionals in the marketplace, so to speak, in circulation to meet this demand? I mean, do you feel like, because I feel like they were on the sidelines, like they kind of have the upper hand now. I think they can start dictating a little bit more of the reimbursements, which is great.
Oh, yeah.
Go you. But do you think that we can meet the demand?
I hope we can get there. I know we've had a national shortage for quite a while now, and there's probably a heat map out there somewhere that shows certain markets that are maybe a little bit more concentrated than others, but it's a national problem.
Is it? Okay.
Yeah. We need more quality mental health therapists in the market.
Why do you think what's playing into that shortage? I know, like in the primary care space, we have a shortage of primary care docs, and there could be a lot of things that people have proposed on LinkedIn, but I think as a general idea is that people want to go into some sort of specialty, whether it's orthopedics or cardiovascular or whatever, whether that's where their interests lie or whether that's where the money is. So we're starting to see a shift with primary care. It's starting to come back with the introduction of, direct primary care, and that being more top of mind, and they can practice healthcare the way they want to and not be dictated by insurance. And it's a membership-based model and not, insurance dictated model. So I just didn't know if you had any ideas on behind that.
I feel there's a lot of things that it hits at the forefront. The amount of compassion fatigue that a provider goes through, it is mentally exhausting to go through one full day of, truly being present and, actively engaging and helping that individual. So to start, it's a very challenging career, and it takes a special provider. Beyond that, I think the increase in usage and utilization in general has thrust, usage forward to a point where we're seeing so many more things that it's okay to reach out and to have a provider that helps me through these things. And so with that being said, financial is a big stressor, always has been for a lot of families. It's not getting any better, with our economy and things that are going on. So that plays a role. Obviously, we live in a very, challenging political environment. We have for quite some time. And so dealing with that, your own personal life, the issues that you might have at work, you're just getting hit from a lot of different avenues. And again, the ability for people to feel like it's okay to have someone to help me through this now. I just feel that that's one of the many things that has really increased the demand from providers.
Yeah. And I know we've talked about a lot thus far, but I'm super curious on, some of the groups. I don't even know how many groups you guys work with now, but it's got to be a lot. Some probably super engaged and some not as engaged, but out of some of like the really engaged HR teams, what are they doing well to promote your solution to their employees?
Yeah, for me, that's a hot button because it really comes from a top-down leadership buy-in. They truly have to. I love it if they have their own personal story. Now, not everybody has their own personal story to share, and if they don't, that's okay. I challenge them to look for someone within their organization that, without getting into names and details, is willing to share how it's, really helped them through certain situations. And, taking that top-down leadership approach, I think, is so important. I'll just give you a real quick example. I do kickoff meetings all the time, and where I see, before we even start with an organization, that first kickoff meeting, to me, I can tell what an organization's usage and utilization is going to be for, in a general sense, if it's going to be good, if it's going to be bad. And it really comes from sometimes an HR director or CEO, depending on the size and scope of a company, will do just a quick, brief bio of me. This is Chad, head of sales, Covenant Workplace Solutions, and then kicks it over to me. And then I go on with my spiel. Well, the best ones are the ones that shock me. In fact, I did one here recently that, an owner of a company took 15 minutes before he even handed it over to me and talked about his own personal story and how they had been with an organization for 10 plus years. And they just weren't getting results. They weren't getting usage and utilization. They weren't getting what they wanted. And he talked about his own personal story, but he made a big pitch as to why they wanted to switch to us. And a big piece for him was that we could meet people where they are. Again, with these low to high touch tools and resources, kind of getting back into the utilization, just being able to meet people with these self-help resources, right, that then lead into sessions, right? And they oftentimes graduate into sessions. I just, having that top-down leadership approach and buy-in, right, in the best case, it's a personal story of their own or their family that they're willing to share, that almost like sets the employees at ease. Like, oh, our CEO, right, has been through this, has gone through this, and is willing to utilize some of these, services. So truly, that's the ones that set themselves, above the rest.
Yeah, and I think I'll just piggyback on that. Some of the HR teams that we work with that are seeing the highest utilization, the most success, they're very intentional about making this a part of their workplace culture. So these organizations are investing, just an enormous amount of money in their people, whether it's just their comp, but also their learning and development. Obviously, all their other benefits that they have there, and it's like, you're spending so much money, you're investing so much money in this. What this program allows an organization to do, if it's done well and it's part of the culture, we're able to establish a strong foundation of mentally well and healthy individuals that you can actually build a thriving workplace culture upon, a highly productive culture.
Can't put that in a spreadsheet.
Right.
You know?
Right. Yeah.
And that's
So
just such an opportunity cost otherwise. Yeah.
yeah,
Anyway.
exactly. If they're not showing up for work, or if they are there but they're not there, they're kind of just mentally checked out while they're at their desk. There's so many factors here, and so we just really help them establish that foundation as a part of their culture. The other HR teams are the ones that really use us as a partner and not just a vendor. And so it's one thing to say, here's your EAP, we'll see in a year at renewal. It's another thing if we're talking every month or every quarter at a minimum and we're saying, hey, what's going well? Let us come in and do a manager training. Let's talk to your managers about how they can be the manager and not their team's therapist, right? And then it gives the managers the tools to lead their team properly and help point them or direct them or guide them to this resource all the way throughout the year.
Yeah, because it's more than just mental health is just not a thing. It's always evolving, right? I mean, with the technology, the political strife and disagreements. And so it's good to be connected to these people to say and you guys get Iowa. And so Cedar Rapids is not like Des Moines, right?
Yep.
And it's not like Dubuque. So you guys are also regionally cultured to understand what's the big things that are challenging, whether it's a rural area with farmers. And well, I want to make sure we touch on farmers here in a little bit. But that's a hugely important deal. And that's what kind of we're trying to do. We're not bragging. We're just saying we need to be in there to find out where you guys are at to make sure that we're fine tuning this thing, because spend a lot of money on your benefits. And if it's, you're just throwing money into the wind otherwise, if it's not working the way you want it to work. And everybody's different.
Yeah, and I'd say, some of our best clients, they're starting to put together like benefits committees or insurance committees to be those culture drivers. And that's what you need to do instead of just one or two people making, benefits decisions. Let's get people from, the different departments to represent, voice their opinions, make decisions, so that way when they are having their meetings, they can plug a certain benefit for 5 minutes. To try and take that, top-down approach that we talked about. I think culture is huge to drive that adoption.
Yeah, absolutely.
All right. I've got a question.
Yeah.
Again. Is that all right? Hi, everybody. Thanks for joining us today. No, this
wasn't a question.
This is such an important discussion today, guys. I just think it's one of these things that's it's interwoven in what we're trying to do. And I'm just curious. I mean, people say there's a mental health crisis. True or false? You think there's a mental health crisis in this country?
I say true.
Yeah, true.
Absolutely true.
Okay. So, all the data points, we talked about that earlier. What do you see that's really the hot button topic right now for people that are calling in? I'm not looking for any details, obviously. I'm just curious, was it the same as it's been in COVID, that I am overwhelmed? I've got anxiety. Is it relationship? Is it financial? What would you say is this thing's evolving? What do you think is your number one, crisis or questions that you're getting when they're reaching out for resources?
I mean, I've got kind of a two-pronged response to that. Number one, I think burnout is a big one, probably one of the most common. But I think one of the great signs that we've seen, at least internally in our data, and this is how I know that Chad's kickoff meetings and the tools and resources we're providing all throughout the year are really making an impact, is because of the diversity of primary issues that we're seeing come through. So we are seeing a nice, not nice, but a balance of relationship challenges to people struggling with anxiety, to folks that are dealing with depression.
Okay.
And we're seeing this because we're getting in there and educating them on this.
Yep.
And we're seeing more of them come out of the woodwork. But from what I've seen, especially anecdotally firsthand from a lot of the meetings that I've been having lately, it's been burnout. What are your thoughts?
Anxiety and depression are the things that often get presented, but it's through a multitude of things, compassion fatigue with a lot of the frontline workers, whether it's, healthcare services or schools, who I consider to be frontline workers. Dealing with anxiety, depression, compassion fatigue is a real big one.
Compassion fatigue.
Yep.
Yeah.
Burnout. I mean, it's
Yeah.
very similar.
Yeah. 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 No, I can't disagree with you. I hear a lot of burnout. People saying I'm burned out. I just can't keep up with, family, my property, whatever. Work is just killing me. And so,
And we're all overstimulated.
Morbidly, yes.
We're on our phones, we're on our TVs,
Yeah.
We got everything going on around us all the
Yeah.
time. We're overstimulated, and that just piles on top of everything else.
Yeah.
With the workout or workshops that we do, would you say burnout prevention is probably the number one workshop that we get requested?
Yeah, burnout prevention has been by far and away the number one workshop we've done the last 2-3+ years.
Yeah. I'm just morbidly curious. I think the audience kind of wants to know what you guys are seeing, because you guys are the front lines too, in the trenches for sure.
Yeah. Maybe you guys could share some misconceptions about, just what you guys see in the marketplace. One kind of story that came to mind was we were working with an employer that, they have a health plan that has a network, that has network providers, whether that's, primary care specialists, mental health providers. She had a daughter, this employee's daughter. She had some suicidal thoughts, and she was trying to get her connected to a mental health provider, calling around to everybody. No one was taking any new patients. And so she's now, trying to find different resources and connecting with virtual options and things like that. So I feel like some employers probably think, well, I have a health insurance plan, we're good. Do you guys come across that?
Less and less. There's those forward-thinking companies that are out there that are ahead of the game, so to speak. But then there's a lot of other companies that, again, kind of check the box and had an EAP and thought that it just takes care of everything. The implementation of the EAP and that buy-in, changing the culture is really the big piece. And so while we have had, we've got a lot of different tools and resources to handle things like suicidal ideation. We've had people call into our 24/7, support line and get help with that. And imagine had this happened to be, one example was a Sunday night, it was a 45-minute call, someone that was dealing with suicidal ideation. Imagine they didn't have that tool or resource. What ripple effects might go through that company had something awful happened, right? And they didn't show up for work the next week. Just again, having a lot of different ways to proactively address some things ahead of time before we're reacting and it's getting into the insurance-based and emergency rooms and different things like that. That's where we absolutely come into play. And it does take education. It takes educating, that CEO, that HR director, that sure, budgets everywhere are tight, but if we have to get into the breakdown of, every dollar that you invest in a robust mental health and wellness program, you get a $5 plus return on investment, right? And how does that show itself out? Well, it's most often seen as far as absenteeism, presenteeism, right? Improvements there. There's a lot of other things, but if we have to break it down to that level to get that individual to understand that we have to be forward thinking to do what's right for our employees and to set them up for success in the future. That's what we're here for.
Well, and that's the thing. It's like, well, how do you really measure success? Because people are likely not going to raise their hand at an employee enrollment meeting saying, man, this is the best EAP I've ever seen. There's a stigma that goes with this still. It's just the way it is. It's my famous saying is when I tell my wife I don't feel well, she says, well, you look fine to me. So.
Well, I think it comes down, so we got to strike the balance between showing real meaningful utilization and the adoption of the program throughout the organization. And with our lifestyle EAP, part of the utilization yeah, there's a place for the EAP counseling, but we also have life coaching.
Mm-hmm.
You know, people that are looking to level up personally or professionally. They're trying to overcome some obstacles or reframe some situations, some big decisions in their life using that mechanism. So we have utilization there. Chad alluded to our self-help program, like our courses, our worksheet toolkits. That's utilization for that person, you know. And so, and then, you know, whether it's the certified financial coaches we connect folks with, all they needed to do is figure out how to create a household budget. And we need to strike a balance between that type of utilization and then also recognizing how important it is about the stories that an organization will never hear about.
Yeah.
They'll never hear about it because their people are engaged, and it doesn't lead to the downstream effects that would have led to a potential crisis or seeking further help through their primary care network.
As we start to close, maybe you each could share some of your favorite stories where, you know, people utilized your guys' solution and, you know, there was obviously a positive outcome.
Can I just say one quick thing?
While they think about their favorite stories, yes.
Yeah, I think it's really important here because this is almost like inevitably people that are listening in are finally getting focused in and understanding, again, we're turbocharging the EAP side of things. You guys have just done marvelous work for my groups. I'm seeing the difference. I'm getting the feedback. And again, it's like I said, I was, you know, jokingly saying, you know, you look fine to me. You don't really necessarily hear about, you might hear about how great a certain part of your health plan is every once in a while because most people don't like their health plan. But, you know, the financial investment to work with your organization is... It's a tiny investment. I mean, it's like a copay a month type of thing.
It almost makes it feel insignificant, right? The value of the service.
Like, you guys are, you know, I'm here to help you raise your prices, I guess. But I'm just saying, it's not that big of an investment. I mean, it's like a copay, right? It's kind of like when we do a wellness plan. It's like, hey, you know, I know you're drinking 2 cases of Mountain Dew a week. You know, if you just cut it out, you know, a 6-pack, you'll lose 50 pounds, you know? So it's just, it's an insignificant amount, but it's pure gold on the other side of it. And the stickiness of this program is just second. And I just wanted to make sure I made that point that, you know, if you're like, what is this thing scary? And after you tell your favorite stories, we want to know how to get a hold of you, because what Colton and I do is the greater good. We're not here to say you can only get this program through our organization. We build these things out across this country, and we want to help there's brokers out there or employers to get a hold of you guys because they need to hear your story beyond a podcast. So,
yeah,
stories.
Well,
you're good. You're good.
I love that. I have so many like thoughts to everything you said because it's so true. Because, you know, the cost, it's almost an inverse relationship. You know, when they see how much our program costs, it almost makes you not take how valuable the program can be seriously because it's not a higher price point, right? Yeah. If it was priced way higher, maybe people would be like, oh yeah, now this is a real deal. But so I appreciate you bringing that up. I did, before I hit on that story too, I wanted to bring up another common misconception is the timeline in which organizations can implement the EAP, right? So, you know, it's been incredibly valuable building a relationship with you guys and the organizations you work with and that you're serving every day. And I think one of the biggest conversations we have regularly is that you don't have to get started on January 1st. Yeah. Like today is, you know, what, April 7th?
We throw enough at them on January 1st.
Yeah, right?
Yeah, 100%.
Yeah. It's so I know it's April 7th, but we can have you going by May 1st. You know, we can have you going June 1st or July 15th. We can do this year round. We have renewals all throughout the year, and the organizations that can move quicker on that, and they don't have to wait till their regular benefits renewal season, all the better. You know, we had a couple organizations get in front of the holidays last year instead of waiting to January 1st, and they had employees using it because the holidays can be tough for some folks, and it's great for others. But having that resource in place was so valuable to them. Yeah. So that's one misconception I wanted to throw out there.
That's a huge one, and because I've you know, we've had the supersonic events happen in our partnership where it's like we have a public body, they have some police officers in crisis, which is our other thing that you're dealing with, obviously. And we've gone in there and, you know, done the supersonic. We want it right now, and you guys have been able to do that. You know, thanks for bringing that up.
Yeah, of course. Well, and part of our role is to help organizations, you know, take this mental health stuff seriously before a crisis really forces their hand to. We have an individual doing an on-site critical incident today for an organization that we didn't meet until yesterday, and they don't have an EAP in place. And it's this incident that occurred. It was a very eye-opening revelation for them. And so any organization we can connect with to get in front of those situations, that's one of the biggest things we're trying to do.
It's huge.
But speaking of the stories, we could go on this forever, but I'm just thinking of a recent one where we have a consumer-facing organization for the most part, multi-location, 4 locations across eastern Iowa, approaching 250 employees. And this organization, we just renewed them into year 4. And, starting out in their first year, they had probably 4 or 5 employees use it. Second year, they had about 7 to 9 employees somewhere in there use it. I'm drawing off my memory here. But most recently, as we reviewed the data, they jumped to 22 employees. Those 22 employees had over 120 sessions. This is just for the EAP counseling. This doesn't include everybody using all the other stuff in the platform. But seeing their utilization essentially jump north of 12% in year 3 speaks to all the work we've been doing as partners for the last few years to engage. And they offer this program to their full-time employees, to their part-time employees. And the other beauty of this is it extends to the immediate family members in the household, right? Because I think what employers are starting to figure out is they can't turn it off when they show up to work. Like there's no separation of like your mental health at home and come to work and just lock in, kind of like the TV show Severance on Apple TV, if you know what I'm talking about. That doesn't exist, right? And so you can't take your cast off at the door if you broke your ankle when you show up at work. You can't shut your mental health off if it's doing poorly at work either. And so this organization recognized this, and the outcome of people showing up to work on time, the lack of absenteeism that they've experienced over this last year has been amazing. And going into year 4, we have even higher expectations, and they're so excited for every employee that they hire that comes on board. It's part of their onboarding process. And so it's just a testament, again, to making a part of their culture and seeing what year 4 brings.
Yeah. Phenomenal.
I love it. Well, similar to Zach, there's so many stories that we could discuss. One that it just rings very common to a lot of different organizations. One in particular, this brand new company had their first year with us. They were with an EAP company for 10, 15 years prior, right? And just never could gain traction, couldn't get any type of utilization less than 0.5% throughout all those years, never higher than that. And they just really were looking for someone that could come in and help them make that change. And they were skeptical that we were going to be able to make a dent and to truly move the needle, when it comes to helping their organization. And, the national average for EAP utilization in general is low. It's even from 3.5% to 4.5%, depending on which study you look at. So let's split the difference, say it's 4%. They're at, 0.5%, over that 10, 15 years. In year 1, they were blown away, that they were at 4.5%, 5%. And that was just after year 1. They now have created their own wellness committee, right? And it wasn't something that the HR director wanted to do. These were employees that were like sharing stories of, things that worked really well for them or their family members. And, it's that trickle flow flood approach to where you hear something, you start to use it yourself. Now they've created their own wellness committee to make an even greater impact going into year 2. There's endless organizations that have that same blueprint, if you will, but those are my favorite stories. The ones that just thought that, this is something that sure we need to have, but I don't know truly what the impact would
Because
be.
then there's stories attached to each of those utilizations that you just may not know.
A thriving workplace culture, as Zach alluded to, some organizations feel like they are there, they have it. But to be able to maintain a thriving workplace culture year after year after year is very challenging in and of itself. And that's where we can come in and help out.
Well, especially with the turnover that we have too.
Right.
Yeah.
Right.
Yeah.
Well, that made me think of one other thing too. Is we have another organization that has a very specialized workforce that they'll have foreign citizens come in and work for their organization. And so as soon as they get to the United States, it's a culture shock for them. So, some of them have a completely different language to begin with. And so part of their onboarding process isn't just all the, cross your T's and dot your I's and the paperwork stuff. It's have one session with your EAP that we give you and just talk about how the transition's going because it's such a big deal. And I'm telling you, just that one piece implemented into their onboarding process has made the world of difference.
Yeah.
And then some of them are like, that was really cool. That really helped me. And they continue on. And others, they just transition swimmingly. So I thought I'd mention that. That was a really unique perspective.
The future is so bright, and I don't want to pick on the state of Iowa. It's where I live and raise my family. But I've seen so many mental health facilities shut down, and I've also watched the dismantling of our primary care and our pharmacies, and so with things that are kind of being reborn with DPC and your relationship with doctors now in Des Moines, they just bolt you onto their. So I think the future is really bright. I love everything that you guys are doing. And thanks for sharing your time, your stories, everything that you're representing. And we're looking forward to doing a lot of great things together. But we want to know how to get a hold of you. Because someone might say, hey, I want to get a proposal. Chad, how long does it take to get a proposal together?
I'll have it to you same day.
Yeah.
So,
Right. So again, we can implement it anytime you want, but we need to know how to get a hold of you guys.
Yeah. I mean, our website it's long. CWS.com was already taken. I don't know who has it, but it was already taken.
Logan's going to write it out for us on the screen.
Oh, okay, great.
He'll write it down. So you'll go ahead and say it anyway.
So covenantworkplacesolutions.com.
Okay.
All one word, .com. That's one way. You can also find us on LinkedIn, both Chad and I, or our page, and you can connect with us that way. Those are probably the best couple of ways.
Perfect. Appreciate you guys coming out.
Yeah,
sharing.
we appreciate the opportunity, and we really appreciate what you two are doing, kind of the tip of the spear in this industry and just doing things different. So I applaud you both.
It's a group effort.
Yeah.
Yeah, swimming against the current for sure. I love it.
Well, got a long way to go. But we're feeling a lot of sunshine right now. So you guys take care. Good to see you as always. Check us out. Good to see you all. As always, give us a call if you have any questions, and certainly get a hold of these fine gentlemen and their organization if you have any questions about a wonderful EAP program. Thanks for joining.